Assalamualaikum everyone, welcome back to my YouTube channel. Now we will talk about autonomy. What is autonomy? We discussed before. Now detail of autonomy will be discussed here. First of all, as the previous section suggests that autonomy in making professional judgment is a litmus test for the professional autonomy can be defined as a extent to which a profession or an individual feels freedom and independence in his or her role. Then, some writers clarified that this includes the freedom from the client, those outside the profession, and the organization that employs the professional. Historically, those occupations whose members have had high autonomy in decision making and high degrees of control over their work have been considered true professions. Occupations whose members enjoyed less autonomy in our decision making and less control over their work were relegated to being semi professions, para-professions, or non professions. The shift toward the managed care during the 1980s had a major impact on the concept of the profession and professionalism. Managed care placed a significant administrative restrictions on the decision made by the healthcare professionals. Many medical professionals perceive this loss of autonomy as a loss of the professional status or deprofessionalization because they were no longer able to freely make decisions based on their expertise and specialized training. As Reed and Evans describe it, because of the crucial link between the autonomy and the professionalism were considerable slippage in the profession autonomy occurs as it has an in medicine the possibility of the professionalization become more tangible. Despite these negative effects, these changes have also stimulated medical professionals to re-examine the concept of professionalism. With the medicine, Stevens called the reinventing professionalism, and Sylvians pointed to the need of the civic professionalization, where the PTs have enough autonomy in their work to be considered professional, has also been a subject of considerable discussion and debate. Until recently, the tendency has been to view physical therapy as an occupation in the process of professionalization, but not yet fully recognized as a profession. However, many PTs have experienced significant increase in their autonomy over the last 20 years. One year of the professional autonomy is assessed to the PTs without the physician referral. In 1985, only 7 states allowed the direct access of the patient to PTs. By the 2002, 35 states permitted direct access and 48 states it allows the PTs to perform the initial evaluation without referrals. The APTA has established the goal of the autonomous practice as one of its priorities delineated in its Vision 2020. Physical therapists will be practitioners of the choice in the client health network and will hold all the privileges of autonomous practice. This raised the question of what is meant by autonomous practice. The APTA board of the directors has developed a position statement to define the term. Use of APTA criteria to evaluate the level of the autonomy exercised by the PTs would undoubtedly result in the enormous variation by the state practice setting and the specific organization. Almost every PT exercise and act on the professional judgment, but few have privileges to refer the patient directly from the diagnostic test. At the same time, the managed care and the other third-party payers have imposed a restriction on the most health care services, including the physical therapy. Organizational constraint also may limit the autonomy. For example, even in states that permit the direct access, organization policies may require a referral for the physical therapy services because many third-party payers require a referral for the reimbursement. Regarding that, if you have any query, you can ask me in comment section. Thank you so much for watching the video.